think can.
Okay, can yes. Alicia, we can start.
Okay, noted on it. Thank you, David. Yay. Welcome back again. For those who are early, once again, thank you for your time, patience. And so today we'll be starting on our English language diabetes education series 1, Stop and Reverse Pre-Diabetes. And today we'll be inviting Staff Nurse Vincent and Staff Nurse Cheng Yu to share with us more about it. For those who have been to our earlier health talk, not sure if you all still remember Vincent. He has actually shared with us previously as well. So if you have any questions, do write it down or type in the chat box, and we will actually help you to answer it accordingly during the end of the session. Passing over to you, Vincent and Cheng Yu.
Hi, good afternoon, everyone. So myself, I'm a staff nurse Cheng Yu, and with me we have staff nurse Vincent today. We are the SGH first. Hi. Yeah, so sorry for the noise. Yeah, so today we are going to talk about Diabetes Education Series 1. The topic is Stop and Reverse Pre-Diabetes. So as you all may already very familiar with this term diabetes, you can read from the newspaper or you can see from the news that recently over the past few years, the government, we have been talking about war on diabetes. So today we will share more on this topic. So let us share what are we going to go through today. So first of all, we will share about what is diabetes, what are the different types of diabetes, what are the causes and risk factors, what are the signs and symptoms, what are the complications, what are the treatment available, and what are the self-care that I can do. So what is diabetes? Are you all familiar with diabetes? So diabetes is a condition where your body cannot manage your sugar properly, and this results in too much sugar in your blood sugar. So what happens when we have diabetes? So let me ask you all one question first. Are there different types of diabetes, or do you all think that there's only one diabetes? Any answer?
Two types of diabetes.
Two types of diabetes. Yes, you are right. Are there even more diabetes? Are there other kind of diabetes apart from type 1 and type 2? Okay, let me explain to all of you. So first of all, we have pre-diabetes. What is pre-diabetes? Pre-diabetes is when our blood sugar is higher than normal, but it is not high enough to be diagnosed as type 2 diabetes. So good news is if you have pre-diabetes, this is reversible. And what you need to do is to have a healthy diet, active lifestyle, and keep your body weight normal. So as just now, thanks for answering the question just now. Yeah, someone mentioned that there's type 2 diabetes. So what is type 2 diabetes? It is actually the most common type of diabetes, which is caused by insulin resistance. And insulin resistance can lead to our body not being able to effectively use insulin to bring the sugar into our body cells. We'll talk more about insulin resistance in our sharing later. And who are at risk of type 2 diabetes? First of all, if you are age 40 and above, or if you are overweight, or if you are physically inactive, you will have a higher risk of developing type 2 diabetes. So what about other types of diabetes? So we have gestational diabetes. So if you have given birth before, you may be familiar with this term gestational diabetes. So gestational diabetes is a diabetes that develops when you are pregnant. So this group of women usually will require specialized obstetric care to prevent the complication of this diabetes that will affect your baby. And usually after delivery, gestational diabetes can be reversed and the woman can continue to live life as per normal, but this group of women usually will have a higher risk of developing type 2 diabetes in later life. And what about type 1 diabetes? So type 1 diabetes, it is usually inherited and it cannot be prevented. It occurs when an organ in our body, namely pancreas, couldn't produce enough insulin. And this group of people with type 1 diabetes usually will require daily injection of insulin. And it usually occurs when you are a children or when you are a young adult, but bear in mind it can also occur at any stage of life. And the complications of type 1 diabetes are usually sudden and life-threatening. Today, we are going to focus on type 2 diabetes, as it is the most common type of diabetes that may affect any one of us. Let me share with you some statistics that's available in Singapore. Do you know that 1 in every 3 Singaporeans is at risk of developing diabetes? And 1 in every 9 Singaporeans have diabetes. And 1 in 3 individuals with diabetes does not know that he or she actually have it. And let me share more with you. In every 3 individuals with diabetes, 1 of them continues to have high blood sugar. And another 2 of them will have newly diagnosed kidney failure. And 1 of them might also have eye disease. And more concerning is every day, about 4 individuals with diabetes have to undergo amputation. So these are very alarming statistics that concern us. Therefore, we need to know more about diabetes and we need to know how to tackle it. Diabetes is a common and yet serious condition in Singapore. So I believe all of you may have already taken your lunch. So let me share with you what happened when we take our lunch. So the food that we eat just now, it becomes sugar when we eat the food. And when it enters our bloodstream, our blood sugar level becomes higher. And insulin, it is a hormone that is created by our pancreas. And it acts as a key to unlock our body cell so that it can allow the sugar to enter the body cell. So the sugar will leave the bloodstream and enter into the cell. And so after that, the blood sugar level will return to normal. And our cell in return will use the sugar to generate energy that require for us to use for everyday life. So do you know that when we eat food high in sugar or refined carbohydrates, our blood sugar will increase instantly? So what are the examples of food high in sugar or refined carbohydrates? For example, some of us may like kueh, some of us may like prata, or in common life, we usually eat white rice, white bread, and we may also enjoy some fruit juice or sweetened beverage like soft drink or 3-in-1 beverages. So these are the food or drink that is high in sugar. And what happens when we eat them often? So when this high amount of sugar enter into our body, the organ in our body, the pancreas, will have to work very hard. And it can cause stress, fatigue, and even damage to our overworked pancreas. And when our pancreas is damaged, it will not be able to produce enough insulin that is required to bring our blood sugar level normal. So look at the picture over here. When we have excess sugar in our body, what happens? So as you can see in the yellow color portion of the picture, fat can actually be accumulated around our organs and around the muscles. And some of you may see there are people who develop fat under the skin around the tummy area. And if you compare these 2 persons in the picture, the one on the left has healthy body and the one on the right have a very fatty body. And this person may be thin outside, but he's actually very fat inside. So when we have so much fat in our body, it increases the risk of getting high blood pressure, high blood sugar, and high blood cholesterol. So what happens next? So let's look at the picture on top, which is green in color. So when we have healthy organs without the fat surrounding the organs, we will have normal insulin level. And normal insulin level will cause us to have normal blood sugar. When we have fatty organs, as demonstrated in the pictures below, our pancreas will produce less insulin, and this will cause high blood sugar level. And what happens when we have so much blood sugar in our body? So as I mentioned earlier on, we may have high blood sugar, high blood pressure, and high cholesterol. And this can result in blood vessel damage. So you can see in the picture, the blood vessel, you can see that there's a narrowing of the blood vessel due to the accumulation of fat in the blood vessel. So when the blood vessel in our brain is affected, we may have a risk of stroke. When the blood vessel is affected in our eyes, we may have blindness or blurring of vision. When it affects the teeth, we may have tooth decay or gum disease. Or when it affects the heart, we may have heart attack. When it affects the kidney, we will have kidney failure, which you often see a lot of patients with diabetes often have to go through hemodialysis or other form of dialysis. And if it affects the feet, it may lead to amputation. So knowing all these complications, my colleague Vincent, he will share with you all what are the risk factors of getting diabetes.
Hello, hi everyone. Just a moment, sorry. Yeah, hi everyone. Hi everyone. So sorry, there's a bit of technical issues. Okay, so thank you, Chen Yu. So after hearing so much regarding what is diabetes, the complications arising from diabetes, the prevalences of diabetes. So now I would like to share with everyone on what are the different risk factors of diabetes. So diabetes can affect everyone, can affect anyone and at any age.
Excuse me, can you speak louder? I cannot hear you.
Can you hear me?
Louder more, please. Thank you.
Yeah, can? Okay, can. All right. So diabetes can affect anyone. And by knowing all these different risk factors, it can help you to prevent and lower the risk of developing diabetes. So now I'll be sharing with everyone on the risk factors of diabetes. So as we can see on this slide, these are the many risk factors of developing type 2 diabetes. First and foremost will be familial history. So if let's say you have a family member who has diabetes, it will result you in having a higher risk of developing type 2 diabetes. Having a high BMI or being overweight of more than 23 kilograms per meter will also precipitate a higher risk factor, as what was mentioned earlier on by Cheng Yu. Inactive lifestyle, for example, not moving actively, not exercising, will also give rise to diabetes as well. The Health Promotion Board in Singapore recommends that we should have at least more than 150 minutes of moderate intensity exercise per week so as to maintain a healthy lifestyle and to reduce the risk factor of developing chronic conditions such as type 2 diabetes. This moderate exercise can be walking, can be just strolling, can be so simple, and it doesn't require specialized equipment. The third the fourth point will be smoking. So as we know that smoking itself can lead to many issues as well, and it also can increase the risk of developing diabetes. Having high blood pressure, high blood cholesterol is also the main issue of developing diabetes, as what was mentioned earlier on, because high blood pressure and high blood cholesterol can damage the vessel and also give rise to development of diabetes over time. Having history of gestational diabetes also is one of the main risk factors. For example, for women who were pregnant and were diagnosed with gestational diabetes, they are likely to have developed type 2 diabetes in their lifetime. So thus, for pregnant women with gestational diabetes, they must watch their diet as well as their conditions closely. 40 years and above, age 40 years and above also precipitate a major risk factor, as well as people with impaired glucose tolerance, which I will be sharing with you more regarding the lab tests and the different diagnostic tests to test whether or not you have diabetes. So these are some of the signs and symptoms associated with type 2 diabetes. As type 2 diabetes is a chronic condition, it's a slow and progressive condition that does not have any signs and symptoms in the early stages. In the early stages of diabetes, people can feel normal and have no symptoms. Unlike, let's say, if an individual have a fever, cold, people will have signs and symptoms such as, sorry, can anyone hear me? Because can everyone hear me?
Yes, yes.
Yes, you can hear you.
Okay, thank you. Okay, so I was saying about the different signs and symptoms. Okay, in the early stages, there is no signs and symptoms that are shown in diabetes, people with diabetes. And it's a silent killer, and it only develops at a later stage where people will then develop the different signs and symptoms. And these signs and symptoms that I'm going to explain to you all or share with you all are the late stages of diabetes. First and foremost, we'll be having blurred vision. Secondly, we'll be feeling thirsty despite drinking sufficient water. Thirdly, will be the poor wound healing as well as cuts. Let's say if you develop some cuts, you will realize that how come the wound takes a longer time to heal? This is also one of the signs and symptoms of diabetes. Feeling tired is also
麻烦你可以讲大声一点吗？很小声啊。
OK， 可以听得到我讲话吗？
你讲的时候很小声，你现在大声一点。
Vincent, do you mind using Chongyu?
Oh, can, sure.
Probably will be better because a bit slightly muffled.
Okay, just give me a moment.
谢谢。
Hello, can you hear me? Hello, everyone can hear me better?
Better.
Okay. Do you mind?
Okay, very good. Okay, so I was
others?
saying some of the signs and symptoms. So some of the signs and symptoms include feeling tired and feeling hungry most of the time, even after a meal, after you eaten, then you still feel hungry as well. So another factor is sometimes you stand on the weighing scale, then you feel that, hey, how come I'm losing weight? So some people may have the misconception that actually people who are obese are likely to have diabetes, but that is not necessarily be the case, because some people may lose weight because their body is not absorbing in sufficient glucose. Then that's why they are still losing weight as well. And if an individual Is going to the toilet to pass urine more often is also one of the overt signs and symptoms of having type 2 diabetes. And some may develop itch, especially around the genital areas. So these are some of the late stage signs and symptoms which will only come out at a later stage. So how are we going to mitigate these issues if this is going to be a silent killer, and how are we going to overcome it? So thus, it brings me to my next point, which I'll be sharing with you all more about the screening. Yep. So for the screening, I will recommend people who are aged 40 years and above to do a screening once every 3 years. So people who are aged 40 years and above have a higher risk of developing type 2 diabetes. And during this period of time, when you visit your GP or the polyclinic doctors for your blood test, your GP or your polyclinic physicians will be able to advise you to take a test and to see what are your risk level. And from there, you can quantify whether are you at risk of developing diabetes? Do you have pre-diabetes, which is reversible? Or do you have diabetes, which necessitates you to make changes to your lifestyle? Thus, this is very important, screening. So how much do we need to pay for screening? Probably that's the next question we want to ask. Yeah. So thankfully, we have this new screening package that is just recently rolled out by the Health Promotion Board as well as the Ministry of Health. So if let's say you are a Pioneer Generation card holder, you don't have to pay anything to go for this screening program. If you're a Merdeka generation, you just only need to pay $2. And the same goes for CHAS card holders, who is orange card holder or the blue card holder, is just $2 per visit. For our pink IC holders, Singapore citizens, it will be $5 per visit. But for PRs, it will be $10 per visit. So this visit, what it entails is the doctors will have an interview with you and they will recommend you to go for the blood tests, which I will be sharing with you more regarding what are the blood tests to test for diabetes. And if you are diagnosed to have risk for pre-diabetes, they will come and follow up with you and they will give you the advice accordingly. So the whole entire coverage for the $5 includes one consultation only, and the follow-up will have to be paid for. So the main question comes about, so what does the doctor says or do if he suspects you having diabetes? So this is part of the screening tool that I'll be sharing with you more in depth detail. So these are the main tests and diagnoses that they will normally do in screening of diabetes. First and foremost will be the HbA1c blood test. So this HbA1c blood test does not require fasting. So what they do is actually to check what is your average blood glucose level for the past 3 months. So for example, if people with diabetes, normally when the doctors ask, okay, you come back for polyclinic screening to check your blood, they want to check the HbA1c to see if you have been compliant to the medications that you are taking, as well as to see how is the average glucose in the blood. Yeah, so as to quantify how is your overall blood glucose level. The second test, which is also the most common test, is the fasting blood glucose test. So as the name suggests, fasting blood glucose requires fasting. So in this procedure, a tube of blood will be taken from you, but you are required to fast for at least 8 hours. Meaning to say that if let's say if you are visiting the clinic in the morning, it will be advisable that you do not eat anything after 12 midnight. Plain water is fine, but not sugar sweetened beverage or any food after 12 if you are taking the blood test at 8 a.m. The last test is the oral glucose tolerance test, which I've mentioned earlier on. So to explain to a bit more in depth, it will be a test where you will combine the fasting blood glucose test, the first one. So it requires you to fast. Thereafter, you are required to drink a sweet sugar solution. And 2 hours later, after consumption of the bottled sugar beverage, you are supposed to take your blood. So this test, 2 hours later, is to test to see whether your body is able to cope with that blood sugar, sudden increase in blood sugar, and to see whether how your pancreas tolerate and how your pancreas is able to secrete enough insulin to counter the increased glucose in your bloodstream. So after knowing all the different tests, now let's take a look at the diagnostic results. So what are the different results that is shown? So on the table itself, okay, the first table, you can see on the first row, here mentioned about the random blood glucose. Okay, so random blood glucose is, if let's say you at home, you have a blood glucose measuring device that you can check your blood sugar at home. You can check it randomly. So any time of the day, you can check your blood sugar, preferably before your meal time. Yeah. So for normal people, it will be below 7.8. While for people with diabetes, it will be more than or equals to 11.1. As for fasting blood glucose, which is the test to actually predetermine whether a person has diabetes or not, which is you require fasting. So for people who have normal fasting blood glucose, it will be less than 6. Or for people who are diabetic, it will be more than or equals to 7. So this links me to the next part, which I'll be talking more about the treatment modalities or the treatment ways how we can cope with diabetes. So as diabetes suggests that it's a chronic condition and it's a lifestyle condition, diet improvement, diet modification is required in each individual and in order to mitigate the issues of diabetes. For example, we can make some alternatives to the type of food we eat. We can, if we want to know more information, we can actually see the doctor and the doctor will get a dietitian to speak to you more regarding your dietary allowance, your recommended dietary allowance daily. And when you see the doctor will prescribe you certain medications if let's say your blood sugar is out of range. So they will give you blood sugar medications to control, can be oral, can be insulin injectables. So you will be required to closely monitor your blood sugar regularly. So these medications will help you control your blood sugar and control your conditions because we want to prevent the complications arising from diabetes. And the third point, which is not in this slide, which I want to share with everyone, is to go for regular screening, because by going religiously to visit the doctor, to see the physician, even if you're not sick, and to maintain, it's a lifestyle maintenance, it will help to reduce or mitigate your risk, or lowering your risk of developing complications and help you to manage diabetes better. So these are some of the self-care techniques for people who have diabetes. Okay, so if the doctor mentioned to you all that, okay, so and so you have diabetes, so there are certain areas that we have to actually look into, like for example, the eye care. So first and foremost, we'll be making sure that the doctors will make sure that you will go for eye check yearly eye check in the polyclinic. So what they will do is they'll check your retina for the blood flow and make sure that the blood vessels are fine. Food care is also essential in the care of diabetes as well. Diabetes, one of the complications of diabetes is actually neuropathy, diabetic neuropathy, which is the damage to the nerve itself. So like what I've mentioned, some people have poor wound healing, especially at the extremities, the legs, the portion there where they will get to injure themselves. Sometimes unknowingly we injure ourselves by cutting ourselves and we cannot feel anything, and we didn't realize that there was an infection going on. So food care is very essential and very important. So I suggest that when you go out and take a walk, after you come back, wash your leg and inspect the leg using a mirror to actually take a look if there's any cuts, any wounds, and if there's any wound, to quickly seek help and to dress up the wound to prevent any complications such as wound infection. This ties into the next point, which is proper skin care. So proper skin care includes applying moisturizer on the skin, because sometimes the skin can be itchy, can be very dry. So do not scratch the skin. And as well as when you apply emollients or skin protectant, do not apply on the base of the leg, because as you walk, it may precipitate you of a higher risk of having a fall. And to apply the skin moisturizer only after you shower for better absorption. And last but not least, dental care, which was what was shared by my colleague Chen Yu about having tooth decay. And these are very important signs and symptoms, and to prevent complications, because dental care is especially important because we enjoy food, we also need to take care of our teeth as well. So these are some tips on prevention and mitigating diabetes. So having a proper diet, which what I shared earlier on, do not smoke, limit your alcohol intake, as this will increase the risk and increase your blood sugar as well, and to engage in regular physical activity of 150 minutes per week. So it can include brisk walking around in the park, and just going down to take a walk. These are considered as physical activities and don't require specialized equipment such as going to a gym or going anywhere specialized to actually conduct your physical activity. It can be so simple within the neighborhood itself. So our next discussion question is, how can I help my loved ones to live a healthier life? So I believe that there are many people who are in this group who are taking care of their loved ones who has diabetes as well. So these are some of the key points that we thought of that might be useful in terms of sharing with your loved ones. Like, for example, you can have cook and have healthy meals together. Like, for example, you all can discuss like, having a healthy alternatives. Maybe consider having brown rice instead of white rice. Exercising together, walking together. I think it's a very good way of having family time. Bonding together one another is a very important way of spending time as well as to keep healthy. The third point is accompany your loved ones to the medical appointment, because through this accompanying the loved ones, you're able to understand what's the progression. Has it got better, or does it require a bit of improvement? And these are important support to the people, to your loved ones who may have this condition. And remember to give affirmation, praise your loved ones for the self-management efforts that they have sustained. Probably they might have cut down on smoking, they may have cut down on drinking. Remember to give positive reinforcement to them and to encourage them further, to tell them that they are doing a good job. Also, can plan social events around diverse activities. Maybe can bring them to the park, bring them somewhere. This also brings about bonding as well. And last but not least, to pair healthy foods with positive events. Like for example, maybe certain festivities, maybe like Chinese New Year, maybe like Christmas, Hari Raya, and can probably cook some healthy dishes using different alternatives, and can use different recipes that are healthier, and this can also lead to better health outcomes as well. So we have a second part of our health talk that will be further talking about diabetes management as well. So please join us for our next health talk. So I've come to the end of the presentation. So thank you so much for your time as well as your attention. We would like to open the floor to everyone for any questions. Thank you.
Okay. When is the next talk?
Sorry.
This is urgent here. When is the next talk actually? Is it next week or the second talk? I mean, continuation of second talk. When is it? Next week or after 15 days? Okay.
Hello. Hi. Hi. Sorry, I didn't catch your question just now. Can you please repeat yourself? Hello. Yeah. Sorry, I didn't catch your question just now.
Oh, he asked when is the next stop? It's on the 24th May. Diabetic series 2.
Ah, yes, correct. That will be the second series. 17th. Yeah, 24th. Sorry, it's the 24th. Yes, it's the English one. Yes, correct.
Thank you.
Is there any other questions?
Maybe other participants have some question to ask.
Please.
Sư công à, sư công.
Sư công.
Sư công à, 多謝你啊，頭先啊師傅幫我啊。
唔係幫你做咩？
Hello, thank you Cheng-Yu and Vincent for the sharing regarding how to reverse our diabetes and as such. So if you all don't have any other questions, then we'll probably end our health talk today. But if should you have any questions on the way, like after we end, like, oh, I got a question to ask my nurse, it's okay. Probably you can write down your question first, then on 24th May we can actually help you to address it. Will that be okay? If yes, can give me a thumbs up on the Zoom or can on your mic to let me know that we are all okay with it.
Okay.
I think so. Okay. Yeah.
Okay.
And thank you very much indeed.
Okay, thank you. I hope you all learned a little bit more about diabetes and
Thank
like
you.
what Staff Nurse Vincent mentioned. 2 weeks later, you will be on our diabetes management, and do join us for it. And likewise, I always repeat myself. If you have not signed up for our health talk, do click on the link to sign yourself up so that we can send you the Zoom link when we have it, so that you all can be on time to join our health talk.
Okay.
So
Thank you.
Yes, so once again, thank you all for participating, and thank you to both our nurses for sharing as well. Thank you. Otherwise, Selamat Hari Raya to our Muslim friends, and meanwhile, do stay safe as well. Okay.
Okay.
Thank you.
Thank you, everyone.
Thank you, and so kind of you.
Thank you.
Thank you.
Thank you. Thanks a
Thank
lot.
you, sister. And
Have a good day.
thank you. Bye-bye.
Bye bye. Bye bye.
Bye-bye.
Bye-bye.
Bye bye.